All right, our next topic is going to be concerned with orienting ourselves with the human body and using some of our anatomical descriptions and locations along with body cavities. So we're going to be focusing on this side of the concept map. We've already covered sections 1.1, 1.2, 1.3, and 1.4, so 1.5 and 1.6 will finish up the topic. If you go ahead and look in your study guide, you should find a picture that looks something like this. This picture does have a couple of items that I want to make point on before we move to identifying those asterisk areas. Those asterisk areas are the areas with an asterisks that we want to actually focus on. However, the gentleman in this picture is standing in anatomical position. If you were in class, we talked about that. The man is standing upright. His palms are facing forward. His hands are at his side, they're not spread out, and his feet are about shoulder width apart. This is the anatomical position, and with the anatomical position, as stated like this, you can then identify the front surface that we're looking at here as the anterior, and then this back surface as the posterior. Of course, the top part up by his head would be superior, down by his feet would be inferior. The midline down the inside would be called medial, and anything away from that midline further to the outside would be considered lateral. We also use the words distal and proximal, and I'll give you an explanation of those at a different time. This diagram is color-coded. The orange color in there, indicated by this little box down here on the bottom, that is identifying the thorax. The purple is identifying the abdominal area, the abdomen, and the blue is the dorsum, or the back. Now that's not terribly important. We probably won't use those terms too often. In fact, most of you have probably heard those terms before. Now the other terms up here that are somewhat significant, you can see there's a lot of leader lines, a lot of blanks. Really the ones with the asterisks, or those with the asterisks, are what we're going to really focus on. So up there at the top in his head, you can see there's a number of lines. The top line there with the asterisk, that's the frontal region. That is right at the area of the frontal bone. We'll learn more about that later on in the skeletal system. The next dot down is pointing to his neck region, specifically right there at his larynx. That is the cervical region. Sorry about that, the iPad went bonky there. So this is the cervical region. So we had the frontal up on top, and we had the cervical region down here in the neck. You can also see that over on the side here. This is the cervical region from the back. His armpit area is called the axillary region, the armpit area there. And then in the center of the abdomen, that is the umbilical region. Up there at the point of his shoulder, that muscle that's coming off there, that's an excellent site for injection, so that's why that's a significant spot for us. That point of the shoulder is called the acromion region. The arm is the brachial region. And then down below there in the crook of the elbow there in the front part, the anterior portion of the elbow, that is called the antecubital. And the reason that's a significant spot is many times that's where an IV would be placed. Over on the other side there, you can see the lumbar region. Lumbar region is fairly important. We have some kidneys located in that spot, so we'll talk more about that. Another side for injections, if you're receiving a shot of some kind or an injection, is the gluteal region here. And then the last one there in the leg, that's another spot where injections can be performed, especially intramuscular. That is the femoral region. So those are the major ones that you need to know. There are other important ones that we'll come across occasionally, especially when we talk about articulations or joints. Down in here, this is the patellar region, and the backside would be the popliteal region. So those are sometimes significant. By the way, the femoral region is both sides. It does cover the backside as well. So I don't think it's probably worth your time to go through and try to memorize all of those, but if you can get these major ones, that would be awesome. Okay, moving on to the next picture. This picture is dealing with body cavities. Whoops, back up here. And these body cavities are important, and we will talk quite a bit about these, especially the body cavity that's colored in red. So you can see that there's a yellow key and a red key at the bottom. The yellow key is talking about or identifying the dorsal body cavity. I'm going to be abbreviating a lot of stuff on here. It's very difficult to write with this pen on the iPad, so you'll have to look some of these up if you're having troubles with the spelling. But the yellow is the dorsal body cavity, and the red is the ventral body cavity. I told you I was going to abbreviate, and then I didn't. So let's focus on the yellow for a second. You can see that the yellow body cavity goes up to the top into the brain area all the way down through the spinal cord area. So you have the cranial cavity up on top, and then you have the spinal cavity going down the back there. So that all makes up the dorsal body cavity. And on the other side, you can see it from a anterior view in the front here. It looks like we have the cranial cavity and then the spinal cavity again. Now the thoracic cavity and the abdominal pelvic cavity make up the ventral body cavity, and you can see it's a lot more complicated. So this is the ventral body cavity over here, but it is made up of multiple parts, and we have a major division here. This line that goes right through here, I shouldn't have chose red, I should have chose a different color here. Maybe I'll change it to green here on the other side. This line right here, that line is a muscle called the diaphragm. And that diaphragm is separating the top part of the ventral body cavity from the lower part of the ventral body cavity. So we collectively call that whole top part, which is what this leader line is identifying, and then this bracket, we call that whole top part the thoracic cavity. Thoracic cavity. Thoracic cavity is pretty complicated. There's actually separate chambers inside the thoracic cavity. There's a chamber here that houses the lungs. That's called the pleural cavity. And then there's a central cavity here that is called the mediastinum. This is the superior mediastinum, and down below is the inferior mediastinum, which houses the pericardial cavity. I'm going to write pericardial in here, or attempt to, pericardial cavity. But keep in mind that the pericardial cavity and the superior mediastinum are all part of the mediastinum. Mediastinum is a word that you're going to encounter a couple of times throughout this course. So it's one that we need to actually learn here. The cavity down below the diaphragm, that is called the abdominal pelvic. That's what this leader line here is for, abdominal pelvic body cavity. And it's made up of the abdominal cavity and the pelvic cavity. Now there is no division between those two. They are continuous, so it's really more of a location. There's not a muscle or a wall like there is separating the thoracic from the abdominal pelvic, the diaphragm. Now the significance of all of these body cavities is that the thoracic body cavity, the organs within, are always lined with membranes because these organs can touch one another. We need to keep them separated and give them some friction-free area so that they don't create friction and cause problems. The pleural cavity is lined with pleura, or pleural membranes. So this cavity here would have pleural membranes. The cavity that houses the heart would have pericardial membranes. And then the abdominal area are going to have what are called peritoneal membranes, or peritoneum. We'll talk more about these membranes because each of these membranes, the pleural membranes, the pericardial membranes, and the peritoneal membranes, all have two different kinds of membranes, visceral and parietal, but we'll talk more about those membranes as we get further along in the course. So, to summarize, you have two major body cavities. You have a dorsal body cavity that includes the cranial and spinal cavities, and then you have the ventral body cavity, which includes the thoracic body cavity up top and the abdominal pelvic cavity on the bottom. The thoracic body cavity, that portion of the ventral body cavity, is actually divided into one pleural cavity on one side, a second pleural cavity on the other side, and a third cavity called the pericardial cavity in the middle. And those house the lungs and heart respectively. Down in the bottom you have a continuous body cavity called the abdominal pelvic, which has the abdominal area on top and the pelvic area down below, but there isn't a separator between those. The significance of that, especially in women, is that if there is a urinary tract infection, that infection can in fact escape the pelvic cavity and get into the abdominal cavity and can cause more issues for that individual. that should conclude our discussion on body cavities and anatomical position. This was a little quick. If you need any help, as always, come in before or after school, and I'd be glad to help you out. Thanks for listening.